Hello everyone, my name is Dr. Joel Rosen. I am the Adrenal Fatigue Recovery Ninja, and today I want to talk to you about neuropathy pain relief. So a little bit different. If you're dealing with numbness, tingling, loss of balance, weird sensations, buzzing, not feeling your toes or your extremities as well, or having a constant buzz, or having a little bit of a leg drop or a weakness, or you're dropping things in your hands. There's a lot of differential diagnosis, and I want to try to relate it back to a stress response. So I have a particular patient that we're working with, and he is in his 70s and he's dealing with a neuropathy, and we've started to do some mechanical work on him. And the mechanical work consists of decompression, so we're taking pressure off the spine. If there's a stenosis or a discogenic problem, or problems with a musculoskeletal component where you're having compression of the nerves, whether it's a central compression or a peripheral compression, that can certainly give relief. We also do some advanced tools to help increase blood flow to the area with a Hacomed or with a PEMF machine, and those can be really wonderful. However, we were doing his metabolic assessment today, and he asked me, will I ever get relief? And I said, well, hey, listen, if you have a mechanical problem, and we've only been working on mechanical so far, you would. But the problem is we have a metabolic issue too. And he said, well, what do you mean by that? And I said, well, metabolic is your ability of your body to make energy. And if you're not making energy effectively, then how on earth are you going to heal your nerves? So what we've done is a metabolic profile, and it's just a comprehensive blood work where we look at his glucose, his A1C, his fasting insulin, all of which were high. Now, glucose was 99. On the lab range is 65 to 99 are your ranges. So he's right at that upper range, but his A1C was 5.7. Now, doctors will say that's not a problem, although it was flagged. It's insulin resistance is what it is. He also had his fasting insulin levels be really high. And we say really high, they were in the 16. I think the ranges is like 2.4 to 26. However, the healthy range is less than 3, and his was in the 16s. So we saw that his triglycerides were high, his LDLs were high, his cholesterol was high, and his HDLs were low. So we need to teach an old dog new tricks. And I told him, hey, you got to look at how much carbs you're eating on a given day, and we got to get it lower than 150. And he goes, well, how much is that? And I'm like, that's for me to know and you to find out. So you have to go on Google and search how many grams of carbs in a potato, and it will say 42. How many grams of carbs in a bowl of rice? 88. How many grams of carbs in a banana? 34. So with that alone, that's your daily limit, and he's way above that, yet he doesn't know. So we gave him the activity of, for the next 3 days, Mr. So-and-so, I want you to look and find out how many grams of carbs you're eating in your daily intake, and I want it to be aiming for 150. And actually, truth be told, it should be lower than that. But that we're just going to start there, and that means, hey, I want you to get rid of your pastas, your grains, your breads, your cakes, your cookies, your donuts, all of that. But I also want you to try to really limit the amounts of rice and oatmeal and cereals and grains that you're having, and get plenty of leafy greens. And I also want you to eat more healthy fats. And he says, well, how do I do that? Through salmon. I said, salmon's good, but you're going to be getting protein with that. Coconut oil, olive oil, ghee butter, seeds and nuts, all of those things will give you more healthy fat. So we're going to start with that. We also saw that his glucose was high, and we're going to support him. When I say glucose, his A1C is with some nutrients to help with insulin signaling. So we have things like bitter melon and gymnema, and there's a couple other ones that we're going to be recommending to him. His BUN was high, and one of the things I start with is hey, listen, we got to get you drinking more water. You're 205 pounds. You should be drinking 102 ounces of water, which is half your body weight in ounces. And I also want you to add another 30 ounces for every coffee you have, and he drinks one coffee. So he should be at about 135 ounces of water a day, and he's probably not even at 40, and his kidneys are taking a beating, and they're also depleted in B vitamins. His protein levels were low, and that's a problem because he's not secreting enough stomach acids. After the age of 20, we really lose our ability to digest foods, and as a result, that food sits there and it ferments, and it causes breakdown of gut lining, causes insulin to spike, and it causes your immune system to be challenged. With his immune system, his vitamin D was 20. He used to do a lot of walking, but since he's had this neuropathy, he hasn't been going out. And I said, listen, we got to get you back out in the sun. We got to get you moving. We got to help with your insulin resistance and your high triglycerides and your cholesterol. We need you to get back in the game. We also recommended some minerals for him. And the other thing we looked at was his white blood cells were high. And we ended up looking at a stool sample, and we're seeing a bunch of stuff on there like he has opportunistic bacteria, he has Staph aureus infections, and that's because he doesn't have enough stomach acids to secrete, to break down his foods, let alone disinfect any bacteria. So the moral of the story is you can do mechanical work on someone, but if you're not looking at the metabolic health, the glucose and the fasting insulin, the A1C, you're not looking at kidney health and water intake, you're not looking at digestive function and protein breakdown, you're not looking at mineral intake and supporting mineral function, you're not looking at immune health with white blood cells and vitamin D, and then you're not looking at gut health, you're not going to have complete relief of this neuropathy problem. So anyways, hopefully that gave you a little bit of food for thought. My name is Dr. Joel Rosen. I am the Adrenal Fatigue Recovery Ninja, and I look forward to ending your neuropathy nightmare. Thank you so much.